Watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures, according to my first guest. He says you can get a fixed set of teeth, a full arch of teeth, in the same day. With us, we've had him on the program before, Dr. Tom Roberts. Dr. Roberts, welcome to the program.
My pleasure, Randy.
Now, for people that don't know your practice, I guess you have a large practice, very busy practice, and you do everything under one roof. Tell me a little bit about it.
We do. Randy, we're an implant-based general practice. Most of our patients come to us on referral from other patients for the most part. We find that those people have a lot of variety of dental needs other than dental implants sometimes. So we also do general dentistry for those folks. Therefore, a total of 3 doctors in the practice, 1 nurse anesthetist. Dr. Singh, who we've met before, is our cosmetic dentist, takes care of how people look.
She's good, you say?
She's really good.
I've seen her photos, by the way.
She does exquisite
people don't like
work.
going to the dentist, right?
They don't.
And she's a female. Are they more likely? Do they like going to the female dentist better?
People do like female dentists. They're perceived as being more gentle, although no one could possibly be more gentle than me. But they are they are perceived as being more gentle, and I kid her about that all the time. Second in line is Dr. Mozan. He's a world-renowned, certainly nationally renowned implant dentist. Great guy, friend of mine for many years. Dr. Mozan is a former president of the American Academy of Implant Dentistry. Works with me when we do large implant cases like we're talking about today.
Now, when we talk on the phone and you say we're a one-stop shop when it comes to dental implants, what does that mean?
Simple terms, it means that we do everything that has to do with your mouth.
Okay.
Period. You need it, we do it in the office, so you don't have to go elsewhere.
All right.
We did it.
Now, when we say, and I know you brought a lot of photos, but when it comes to dental implants, and people need to know it's a real interview. I'm not trying to endorse you or side with you. We're not reading scripts here. But the way it's normally done, nationwide, is you go to one person for the dental implant, like a surgeon.
Correct.
You go somewhere else, they put the teeth on top. You go somewhere else, they do the imaging. And then you send out the teeth and get the teeth made, and you do all of those things.
We take a different approach, a convenience-related approach. We call ourselves a patient-centered versus a doctor-centered practice. What you described was a doctor.
But does that really go on? Is that how it's normally done?
That is how it's normally done. In our case, we take a patient-centered approach versus a doctor-centered approach. Convenience of the patient has a lot to do with success of the entire case. So we'll have you in, we'll do the surgery, we'll do the prosthetic work, the teeth, we'll do the IV sedation, we'll do the laboratory work, all under one roof, so that it can all be handled efficiently, effectively, with the highest degree of quality.
Are there a lot of
That's
people?
our issues.
Are there a lot of people with dentures where you are? Like an upper and lower denture? Within an hour of your practice, would you say
tens of thousands at least, if not 100?
Right, that many people.
Yeah, I would say.
And you say, and I don't want to put words in your mouth, but with just 4 implants, they could get a full arch of teeth that don't come in and out.
There are cases where we can do, with 4 implants, do a full set of upper or lower teeth.
And often do. If that's true, why aren't all the denture wearers doing it? Help me understand that.
That's a good question. I like to say that the knowledge base, the public's knowledge base about implant dentistry is decades old. They don't know their options. They don't know what can be done and can't be done. No one's taught them.
Okay.
Denture wearers don't go to the dentist, for the most part.
A good point, okay.
They come in to have a reline every 2 or 3 years, maybe something like that, but they don't talk to their dentist. They don't talk to any dentist for the most part. And there's not really good publication, in publications, in journals, newspapers about implant dentistry. There's not a lot of word out there. They don't know, unfortunately, how much help there is available. Back to your question, Randy, one of the main reasons why people don't change their lifestyle when they're wearing dentures, as far as their dentistry is concerned, is they are afraid of a lot of things. They're afraid of pain. They're afraid of the amount of time it will take.
Seems painful, though.
It's not painful, Randy. In our practice, we spend an awful lot of time making sure that it's not painful. Last Tuesday, I had a patient who the anesthesia, the sedation that we give them, and said to me, "What time is it?" And I said, "What time do you think it is?" She said, 10 after 9. Her appointment was at 9 o'clock.
Okay.
Well, it was 11:30. She said, "When am I going to get my teeth in?" She thought I had kept her waiting. Her teeth were in, the surgery was done. It was 11:30, and she felt nothing. That's how we control pain in our office.
Now, we're probably going to have to put disclaimers. I mean, everybody feels pain differently, right? But some people don't complain about it, right?
People do have different pain thresholds, that's correct. But our point is to get, I was in the hospital the other day. visiting a friend, actually an employee, and I saw this chart on the wall in front of the patient's bed. It said, "What is your pain tolerance?" And it had 1 to 10. This is some new thing that I guess hospitals are doing.
Yeah.
And it was really strange that the pain tolerance is 0. That's what it should be. You can't choose a pain tolerance. Your pain tolerance is 0. You don't want to have pain. So, and the question was, what level of pain are you willing to accept? I'm willing to accept no pain because it's not pleasant.
Okay.
So my office is dedicated to,
So during the procedure, you don't feel pain, obviously.
You don't feel pain during the procedure because of local anesthesia
But
that's
after
effective.
the procedure, it's tolerable.
After the procedure, if the procedure is done well,
Okay.
quickly, I would say about pain, Randy, don't let it get in the way of having dental work done.
Having this done. So you say there's tens of thousands of people missing teeth, loose-fitting dentures, and they're afraid of pain. And now what about age? How old can you be to get dental implants? Because I know somebody, 30 years in dentures.
Mm-hmm. There is no limit, Randy, upper limit on age. My oldest patient is 94. We commonly have many patients in their late 80s.
Late
It is
80s.
not uncommon. You know, people
Aren't
are
they
living
more
longer
likely
today.
to fall out, though?
No, they're not, Randy. Patients who have dental implants at any age, even late 80s, as I said, where there are many in our practice, bone grows. Bone continues to metabolize throughout a person's life.
You said your oldest patient, 94. Why would a 94-year-old want to do this?
Why would they not? Lifestyle.
Okay.
Everyone wants to look better. Everyone wants to be able to chew. Everyone wants to be able to feel the confidence and the security, social security, if you will, that people have when they have non-removable teeth, or teeth that look good, better than their old.
So this 94-year-old patient, I guess, is your mother, you told me.
That's right.
Okay. So what'd she say? I mean, when it's all done, what does she say?
Let's go out to dinner, actually, because
that right?
we've finished about dinner time. You know, whether you're 94-year-old or not, you still have the same feelings, the same desires that all of us do. You want to have self-esteem. You want to have security and confidence in the way you look, the way you feel. You want to be able to chew. You want to be able to eat in front of people. You want to be able to go to a restaurant or when someone says go to a restaurant, you want to be able to say, let's go get a steak, not let's go to Italian and have pasta. You know, age is a non-limiting factor in implantology, as it should be. People live now into their hundreds oftentimes without. We do have dental implant patients who are in their hundreds. We have 2 of them, I think,
Wow.
right now. Not that I did implants on, but that our implant patients referred to me from another dentist who did implants years ago and them up north. We're in Florida.
So no more dentures. We said that at the top of the show.
That's
I mean,
my
is that
goal
the
in life.
future of dentistry? You say it's
I
your
hope
goal in
that is
life?
absolutely the future of dentistry.
Elaborate on that. You say it's your goal in life.
It's my goal in life to make people comfortable with them. I want people to come in. In fact, my first question when a new patient sits down in front of me, Randy, is what is it about your teeth that affects your life?
What do they normally say?
They start the litany that we've talked about. Oh, I can't eat. I can't chew. I can't go to the restaurant I want. I'm not comfortable. My patient's always squinched up holding my dentures out. Here.
Okay. Let's take a look. What are we looking at here?
We're looking at a patient who had a denture, now doesn't have a denture. One day, same day, she's wearing the same shirt.
Okay.
That's
a good one.
We didn't ask her to bring back the shirt after 3 months. She's wearing the same shirt because she had the same shirt on the whole time. We covered her up. But anyway.
Same day walks out with teeth.
Look at the difference.
Supported by dental implants, like a fixed set of teeth?
It's a fixed set of teeth. Look what it does to her facial features.
She looks younger.
You know, she's in her early 80s. Do you think that gal...
Whoa.
Does she not have a significant life ahead of her? Does she not have something that she wants to accomplish?
So she can eat whatever she wants?
She can eat whatever she wants? That's an old picture.
So you
She's been
call
around
it
for a long
an
time.
all-on 4. That means 4 implants, for example, on the lower, you get a fixed set of teeth.
Fixed set of teeth.
Is that right?
Absolutely right.
It's
In
that
a
simple.
single day, no discomfort, done.
Limited or?
Minimal.
Minimal discomfort. Okay. So with this woman, so she's eating and chewing. But isn't it true, though, if you've been in dentures for 30 years, and we've talked a little bit about this, that you lose bone, many people have not enough bone to do this. Is that right? I mean, if you've been in dentures 20, 30 years, you can't do this.
After 20 or 30 years, you do lose a lot of bone, but there is not a problem with that with current technology. We do dental implants every day for people who have been told by other dentists that they don't have enough bone. That's a common misconception.
If you've been told elsewhere you don't have enough bone,
It's a misconception for the most part.
you have more photos. What else are we looking at here?
Oh gosh, okay. Betty, a real sweetheart. An insecurity issue. Had a denture. Now has fixed teeth. Betty wouldn't let me take a before picture. So that's why I only have one picture of Betty. She never let me take a before picture because she didn't like the way she looked. She didn't.
She had no
socialize.
teeth, or what was going on?
Pardon?
I mean, why didn't she like, what was wrong with her teeth?
She had a denture and they were so far receded under her gum line that it looked like she had no teeth at all. We gave her dental implants, as you can see, a properly designed set of teeth that came down a little bit below her lip. She had a tremendous smile, beautiful look then. Her issue was security, confidence, socially. She just didn't have it. She didn't want to do anything. She didn't want to talk to me. She smiled and you couldn't see her teeth, like this, and there were no teeth showing. She had dental implants done in one day. Change overnight in terms of her self-image. Look at her now. She looks like she has real teeth. Her personality,
Yeah, it looks nice.
her outgoingness, which she had none of before, completely changed. I'll tell you a story, personal story about her. She started showing up. We give, our practice gives public information seminars around the Palm Beach County area where we live. We go to a hotel on a Friday afternoon and we invite people to come in and learn about dental implants. An educational seminar, free of charge. We do it commonly during the course of the year. Betty would see an ad in the paper for one of those seminars, or after she got those teeth, she showed up at the seminar.
Not even invited.
Not even, we didn't ask her. She showed up. She said, "Can I speak?" I said, "Betty, you want to speak in public now? You're not. You wouldn't even speak to me. You know, you practically wrote what you wanted me to do for you down. You were going like this." She said, "I want to tell these people." And we had first seminar that Betty attended. We had 100 people. I'm afraid to speak with the 100 people. She got up and spoke for, I think, 5 to 7 minutes in that seminar about her experience in our office. And she has continued to do that for the last 15 years.
So what's the best thing? I mean, when it's all done, did they say I should have done this years ago? Are they more happy about the eating part of it? What is it?
You know, everybody has a different issue going in and a different happiness about how they came out of the dental implant experience. Some people, it's just, I can eat a steak. I'll tell you another story. We have a lady and her husband who own a franchise, a barbecue ribs restaurant. 23 years they owned this restaurant. And she had never eaten the food, the corn on the cob and the barbecue
At her own
ribs
restaurant?
At her own restaurant, without a knife and fork. She came into me after we finished a case, oh gosh, it's been several years ago now, but it was a teeth in a day type case. And she said to me, almost with tears in her eyes, Randy, she said to me, "I sat in that restaurant where I've sat for the last 23 years and did this with a rib. I did this with the corn on the cob.
Wow.
Couldn't do that before."
And that's typical.
It's an emotional, this business of going from, you know, for you and me, we don't understand it. Well, I understand it a little bit because I see it every day. It's an emotional moment, really emotional moment, when you go from dentures or just nasty teeth that just don't work. They look bad, they feel bad, they're broken off, there's not all of them even present. It's an emotional experience for that person when they see themselves, feel those teeth, and see themselves in the mirror, not holding the denture in like this, not going like this, like the first one that I showed you was to hold the denture in. And that, there, with every single dental implant, major dental implant case that I've ever seen, Randy, there is that emotional moment. And I had, am I too big on the stories here?
No, that's good.
I have another patient with who
Oh, you
called
like
me.
this. It's obvious. Go ahead.
She gave me that line. She gave me the emotional moment line, and I use it. I tell people they're going to have it. You call me and you tell me when you have that emotional moment because I want you to do it. Another patient, a lady much like Betty, about her age, called me after walking out of the bathroom for the first day, the day of surgery. This was the day after surgery, day of an all-on-4 type surgery.
Yeah.
And she said, I went into the bathroom, I looked at myself. The teeth were beautiful, thank you. But I went like this. They didn't come out.
Because they're so used to.
Took me back. And now this is a long, long way of answering your last question. She couldn't take them out. She said, 30 years ago, I had my teeth taken out, had a denture put in the same day. You didn't do it. You're the
Okay.
dentist. And I came home to this bathroom, to that mirror, and I pulled out that immediately placed denture, and I saw myself look like my grandmother. And I could hear Randy on the phone. She was calling me the day of surgery to tell me this. I could see on the phone. I get tears in my eyes. I could hear on the phone tears in her eyes.
Good.
And
Very nice.
I'll tell you, that was an emotional moment for me.
Now, switching gears here for just a moment, because we're almost out of time. But for people that want to, the group of people that their mouth is a mess, as you say, we've talked on the phone,
Yeah.
and that they want to avoid false teeth, but they haven't been to the dentist in maybe 10, 15 years, which is hard to believe. Is that common, by the way? People come to you and say,
Yeah.
I haven't been to the dentist. And
It's very common in our practice.
can your gums be too bad to get dental implants?
No. Gum disease goes away when you have your teeth taken out. So people that are teeth are a mess, the teeth have to be extracted, they don't want to have dentures. Gum disease disappears with the teeth. I
Okay.
can go into why that is, but that's what it is.
All right.
If gum disease disappears with the teeth, then we don't worry about gum disease, we worry about bone
And the
preservation.
gums get healthy?
Gums get very healthy. When the teeth are gone and the bacteria associated with periodontal disease are gone, the gums get very healthy. So that is the ideal time to have implants, dental implants placed, because the gums are now healthy, the bacteria, the infection, which is a risk factor for dental implants, are gone. You have one risk factor taken out of the picture. You can put dental implants in there. You have more bone. The bone shrinks when you wear a denture over time. The bone doesn't shrink in a short time, so after you have your teeth out, it's the ideal time to have implants placed and to have fixed teeth placed on those implants.
Now, you're big into laser dentistry. I mean, we've had you on the show talking about this.
Yeah.
And so with people, though, you also save teeth. So it may be a combination of dental implants,
Yeah.
saving teeth. Elaborate on that.
There are teeth that some are savable and some are not. We have to get rid of the gum disease if we're going to save the teeth, because the gum disease can affect the implants. The disease can transfer from the gums to or from the teeth to the implants. So we do use a very, very high degree of technology with laser-assisted periodontal therapy.
Okay.
The LANAP procedure is called. And that is a wonderful way to treat both dental implants that might be starting to get into trouble after many years, or it is a wonderful way to treat periodontal disease. We can get rid of the infection, save the teeth, and have to do only a limited number of dental implants for those folks.
Okay, and this could all be done in the same day.
Be done the same day.
Is it because the way you have it set up in your office? We talked a little bit about it.
It is
that
the way.
why? Because most guys, and we've talked on the phone, you say some guys it takes 9 months or a year to do what you do in the same day.
Yeah.
Is that true?
It's true. It's definitely true, Randy, because traditionally implants are placed and a number of months go by before you have the teeth, or before the bone is ready to have the teeth placed. Then the teeth have to be placed. They have to go out to a laboratory. It takes 2 or 3 weeks to have them made. They're back and forth. We have the infrastructure in the office with the all on 4 teeth in a day, whatever trade name you want to put on it, the single day implant procedures that allow us to make teeth in the office while you're having the surgery done, place them upon the implants, and have the implants and the natural teeth healthy, happy, ready to go from there.
Now, on the internet, like on YouTube, they're showing after this procedure, this all-on-4 procedure, some people are biting into an apple, patients, the same day of the surgery.
Yeah. People do that.
True?
They definitely do that, Randy. It's not what we recommend, though. We recommend a gradual return to a normal apple-type diet. Soft foods certainly for the first few days, first few months, really, moderate food, chicken, fish, well-cooked vegetables, that sort of thing. You know, when you get 3-4 months down the road, then you go to the apple.
Do you hear eating stories, by the way, over the years where the patients come in when it's all done?
Yeah.
And they tell you?
All day long, all day long. Eating probably is the single biggest, because we do it so often. You know, we eat every day. Much of our social life is tied up with eating, going out to dinner with friends, family, things like that. It's so important socially to be able to eat with confidence. That it's not so much what I can eat food-wise, it's that I can eat with confidence, that my denture is going to not click or clack, that, you know, I'm going to have decent-looking teeth when I smile when I'm at the table. It's just a whole plethora of things but eating is a huge.
Now, separate to that, because and we are out of time, but you said, Randy, it's not about dental implants. It's also about having a beautiful smile. Now, you're a dentist, of course. You probably think the smile is important.
Yeah.
Right?
Smile
How important
is everything.
How important is it? As you see,
Tremendously important for the social security, confidence of the patient. That patient needs to feel. In order to have the confidence, they say a picture's worth 1,000 words, Randy. Look at this woman.
Okay.
She came into me complaining that my teeth don't show, my teeth look dingy, the gums are too high, I don't look good, I'm a social person, I like to go out, I like to have fun. So I said to her, well, we can do some dental implants in the back, we can get you some veneers and we can sedate you because it's going to be a long procedure. We can say, hey, we can get it done in one day if you want to. And we did that.
Wow.
And she now looks completely different. Look at her.
Yeah, when you compare the before and after, it is a different look, for sure.
She's the same person, but she has a different attitude towards the way she looks. And that's what real dentistry does. That's what good, thoughtful, cosmetic dentistry combined with implant foundations can do, is give you the ability to do what you want with your face with confidence. Confidence that you're going to look to your audience, whether it's your husband, whether it's a friend, whether it's people you don't even know and you're meeting for the first time, their first experience with you is going to be great. The smile is everything. Your teeth are your ambassadors to the world.
Okay.
Have them say the right thing.
We are out of time. Good stuff. Final message, though. We're talking about no more dentures and people, I guess, that don't know where they stand. Their teeth are, in bad shape. Mm-hmm. What's your message to them? And maybe the denture wearers are still skeptical that it can be done in one day, the same day.
Yeah. Simple, short, sweet message to them is find out what your options are. Go to your dentist. Ask your dentist. That's the first thing I ask people. Tell people if I meet them in a social situation. Ask your dentist, what can be done today? Again, I think I said this before in the program. People are operating with a knowledge base that is decades old with regard to implant dentistry. We want those folks to understand their options. Go to your dentist, get a referral if he doesn't or she doesn't do dental implants. Learn about dental implants, get a second opinion. Let's find out what can be done for you. This is a hugely important thing in your life, whether or not you do this.
Your consultations are free. I mean, you don't charge for consultations. Do they get to see you?
They get to see me every time.
Okay. And good. And how soon, by the way, by the time they walk in, how soon can you, with predictability, say, we can do this? You're a candidate. Same day? I mean, you tell them?
Pretty much same day, yeah.
Okay.
Be an unusual case if it weren't same day.
All right. I want to thank you for coming on the show. Always a pleasure to have you on the show.
My pleasure, Randy. Thank you.
All right. You've been watching The Wellness Hour. I'm Randy Alvarez. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.